What if I told you that physical therapy isn't just about getting back to normal? It's about getting better than before. Physical therapy isn't just for athletes, it's for all of us who want to feel good in our bodies again. I'm Dr. Jay Rutland, and this is the Health Exchange. Today, we're talking with Dr. Tony Dang about how personalized, hands-on physical therapy can help you move better, stay pain-free, and live stronger. Let's get into it. Tony, can I call you Tony?
That's perfect.
All right, you can call me Jamie. All right, Tony, what is physical therapy and why do we need it?
Physical therapy is a healthcare specialty that focuses on improving physical function and mobility. So if you're, recovering from surgery or from a stroke, that's usually seen in the acute setting, so at the hospital, or in the outpatient setting where, if you're able to travel to the clinic and you're more able-bodied, that's the other side of PT. So PT has so many different uses for different types of ailments. So you could go from the acute settings to the outpatient setting. One thing that's really gone big over the last few years is pelvic floor PT, even like neuro and concussion type PT. So yeah, PT can be used for many different things, but in different settings as well.
So give me an example of kind of acute physical therapy in a patient. You come up with your example that you've seen and treated.
So let's say a patient suffers from a stroke, right?
Sometimes stroke, lack of blood flow to a certain part of the brain,
Yep.
loss of function of the nerves from that output. Okay.
Yeah. So they're essentially trying to regain physical function so that they can return home, right? Before they can be discharged to go home. So whether that's like being able to transfer, right? Get out of bed, walk, use a restroom, feed themselves, right? Because some people don't have that type of help at home. So you're getting that type of care to help establish those functions again.
And give me an example of what you would do for a post-stroke patient.
For a post-stroke patient, pretty much teach them how to use the affected limb or the affected side again, right? So just getting them to be aware of it and start getting them to physically be able to regain some strength, some sensation, just motor control, sensation, all that stuff.
How did you get where you are today, and why physical therapy in the first place?
Well, I think I'm probably one of the successful PT patient stories. In high school, I tore both my ACLs, underwent successful PT, and after that, went to college, learned more about the field, and after college, went to UC San Diego, went to graduate school, St. Augustine, got some professional training there, and after that, I ended up here as a PT. But yeah, it rooted in sports and just my personal injury, and I just want to help others, and this is where we're at.
Where's St. Augustine?
It's just north of San Diego, in San Marcos, probably about 30 minutes away. I wanted to stay in SoCal, just close to home, and it was like a fast track tuition. So, that piqued my interest, and they have like a heavy interest in manual therapy.
Yeah.
So, I want to get some training in that aspect for sure.
How did you injure your ACLs?
In basketball, just playing too much. It was like a freak injury though. I went up for a traditional layup, landed, my knee went out, it buckled, and that was my first time getting hurt, specific to my knee. And, just based on previous injuries, like ankle injuries, ankle sprains, you play basketball, you think that you could just play it off, right? And I thought I could, and I just kept trying to play on it, and eventually the other one ruptured. I didn't know this at the time, but I went to see an ortho, and ortho says, hey, why don't you just get MRI on both knees? So screw it, why not? Results came back, and they said full rupture, ACL, MCL, meniscus, right side, and the left side. So this happened at the same time. And
how old were you?
14.
14 years old.
Yeah.
And you grew up in San Diego?
No, I grew up here in LA.
In LA. So
Yeah.
14 years old, basketball player, hoop dreams, I get it. Tore both your ACLs.
Yep.
And then what?
And yeah, I was ready to get the surgery. Ortho was, based on this, if you ever want to get back into playing competitively, running, whatever, surgery is the best route. And you've seen other people do it and you're like, well, that's the only option that we have. But my sister, she's a nurse. She works in a hospital. She works bedside. And she said, hey, why don't you try PT first? And, I've had some good PT, some bad PT, some good experience, some not so great experiences. But eventually I got to a point where I could like run and jump again without much complications. So that just really piqued my interest.
Listen, I had two loves in my life growing up, and my number one love was basketball. And I loved basketball. I loved playing it. I loved making people look bad when they tried to guard me. Like I loved everything about basketball, the competition, everything. And I was a senior, going into my senior year of high school. I started to have knee pain after we did our conditioning. And the football coach my senior year convinced me to play football. And I was stupid. And I was like, oh, yeah, sure, I'll go play. So I went out to a football practice for like a week. I was playing receiver. And I was like, dude, I'm not doing this. Like, I don't want to get hit. Like, no, it's not happening. But my knee started hurting then. And I kept playing. Never missed a game. Never missed anything. Never missed a practice. My right knee just kept hurting and hurting a little bit more. That summer before it started hurting, I had like, I don't know, 2 or 3 like 40-point games. Like I was balling. And then it started to hurt, whatever. I didn't think anything of it, right? Started to get recruited, but it was hurting. And I remember getting to UC Davis. I remember going to a spring practice at Davis. And it still hurt. I could play, but it still hurt. And I was like, I can't play on this. Like it just took all of the joy away. And I did physical therapy. It kind of helped. Not really. It still hurt.
Yeah.
I mean, there's so many people that do physical therapy, and then there's people that actually do physical therapy, right? I mean, you know this. There's a difference between practitioners. There always is. And it's just like hearing your story gives me hope for the person like behind me that suffers what I suffered. I eventually had surgery on my right knee, took the diseased patella tendon out. It was pain-free in medical school. Like our intramural team was bomb. We won a championship, beat all the college kids. Like it was crazy. Like we were really good. But then the pain came back and now both knees hurt and it's over. Like it's, it's like I can't play basketball. I can shoot around, but I can't play like I played. But hearing your story, it brings me hope because physical therapy and injury rehab work. So how do you incorporate that in training? Like, what do you do for these individuals that come in with, say, patella tendonitis?
I think the approach is, I think, the most important part about this, right? If you come in to me and you're complaining of knee pain, my focus is going to be to how do we take care of that knee? But my question first is, what is triggering that knee pain in the first place? How were you able to get through, pretty much all the way to your junior year, pain-free, and then your senior? What changed, right? And it sounds like you added another sport. So there's probably a different type of load that you're putting on your body, right? So I'm trying to like really get the full picture of the person in front of me. So I don't really just treat the knees per se. I want to see how you walk. I want to see how you run. I want to see how you jump. I want to see how you squat. I want to see how balanced you are, right? I want to see how strong you are. I want to take a look at all these different things because a lot of times, most people that come to us, when they complain of pain somewhere, their thinking is, wow, that's the weak part. But rarely is it the weak part. It's the part that's being overcompensated. Yeah.
So you're evaluating patients based on their gait, based on how they operate within their sport, within their life, and how they're stressing their joints or their muscles to understand if a weakness in a muscle or a weakness in another joint is contributing to that overcompensation on the painful part of their body.
Correct. Yeah. So it's like we compare it to like performance-based PT, right? So that's what we label it, performance-based PT. When you go to a doctor and you complain of these issues, the doctor, you usually, say, hey, let's get some labs in. We'll take a look at that and we can figure out the next steps from there. For us, we don't really look at those things, right? For us, we look at, okay, how can you do this particular activity and what's the quality of that, that said activity? whether that's a squat or even just raising your arms overhead, right? For instance, I have this patient. She's a Krav Maga specialist. She's training for an upcoming belt. And she came in complaining of hip, shoulder, and knee issues. And for her, using her upper extremity is really important. And she had limitations in just raising her arm overhead, right? And that's the thing that we're assessing, right? We want to make sure that you can get that arm to move overhead. And in a matter of weeks, we're able to get her to do, she was able to do 8 pull-ups in a row. She's strong without fail and with no pain. So that's how I judge if someone's getting better or not. And then not necessarily like every day you come in, how's your pain? How's your pain? It's, hey, can you do this better than the last time you came in? And that's how we judge someone's progress.
So let's just pretend it's me. I'm coming to your clinic, right? And I'm like, hey, I've had knee pain since I was 17 years old. I'm 44.
Mhm.
I've had knee pain since I was 17 years old. Take me through what you would do next.
Well, I think first I would probably ask you like, hey, what are you looking to get back into doing, right? Are you just here to get rid of the pain, or are you actually here because you want to get back into playing basketball?
I'm here because I want to play I want to play a basketball game and it doesn't hurt.
Based on what you're describing there, we're probably going to need to do a really extensive assessment, really in depth. First, we're going to look at how you walk, right? From just your normal gait pattern to how you balance on a single leg, how you run, how you squat, how you do all these various movements. And then we, based on that, we grade your quality of movement. And then after that, we're going to look at each individual segment. If it's your right side, we're going to take a look at how the entire right side is moving, right? From your foot to your knees, to your hips, to your low back. Take a look at the whole thing. And we put all that information together and we get a full picture. Jamie, you're having a lot of knee pain because you have no mobility in your hips. You prefer to walk in this pattern. You prefer to run in this pattern. It's overloading that right side. And the most important thing about that is I want you to really understand why it's happening, right? I need you to get buy-in immediately. I need you to be educated. I need you to understand the process behind everything. And then from there, we can create a plan of care. Because if I don't have your buy-in at day one, then we're probably not going to get anywhere. Because for myself, I'm just a guide, like an air traffic controller, right? I can instruct you how to move the plane, but you're moving the plane. So I want to make sure that you understand where we're going, why we're doing this. And, we lay out a plan of care and say, hey, based on all these impairments that we found, it's going to take this many weeks to get there.
So in college, I was an exercise biology major, and you're talking biomechanics. You're talking like human movement and how things move together in unison and whatever. And I think that that's fascinating. Now, when you're evaluating that, are you eyeballing it, or is there a machine that you have? Is there a computer system that you use to evaluate gait? Like, how are you evaluating that?
I think nowadays we have the luxury of a cell phone, and that can capture so much useful information, and we can immediately refer to it, right? And that's like the easiest way. We have other fancy material or equipment to help assess, but I think you're here just to get as much out of that session as possible. So all the fancy equipment, I sometimes don't even use it because it just takes up too much time to set up, so forth. So it's eyeball, but recorded on video for your resources, for myself, and we can track it.
So do you think if I just got up here and I just walked across this room right now, you could be like, yeah, your walk is fucked up. That's why your knee hurts. Could you do that?
It's funny because when I used to work in New York City, that was my lunchtime task for my PT that I was supervising. We would go to Central Park. We would go to Central Park, have lunch, and we would just analyze everyone's gait. And I would give my thoughts, for why this person was dealing with X. Usually we would try to label those people that were wearing knee braces or whatever, and he would give me his reasoning. So we do that. It's just kind of been ingrained to my self-conscious. So even if you didn't tell me to do that, I probably already did that.
Tell me about a patient of yours that you've had in the past that reminds you why you do it the way you do.
So I have this teammate, high school basketball teammate. He's a few years younger than me, and he's always been into hoops, so much so that he's even created a whole brand around basketball himself. And just this year, he came to me to get treatment for his ACL. So something that just really resonates with me. This was maybe 2 days after he had injured it in some recreational basketball league.
Did he rupture it or no?
He wasn't sure, right? But he wanted to come see me before he went to the ortho. So he came in, and immediately it didn't present as a normal ACL injury, right? He could walk relatively fine. The swelling was minimal, because usually when there's like an injury like that, swelling is pretty profuse, right? So I said, hey, you know what? Go see your ortho, get the MRIs, let's see what it says. Got the MRI back, but he did say that, hey, even though we got the results, my knee's feeling a lot better, right? But the MRI said you have full thickness rupture of the ACL on the left side, and they scheduled essentially a procedure within the month, like 3 to 4 weeks later. Within that time, we just try to do as much prehab as possible, right? And by that month mark, he was scheduled for his operation. He came in and he was double booked that day. So the surgeon said, hey, just come back another day. We'll figure out another time. So this time he was upset, right? But he was feeling better. So he was like kind of glad that didn't happen. But he did wanted to proceed with the procedure. So he went to another surgeon, and that surgeon says, hey, let's do another MRI, right? Let's see what it actually looks like now without all the swelling. That surgeon says, there is no ACL rupture. That really resonated with me because, like, as someone that didn't go through any type of ACL procedure, he was able to still be very functional. So we just kept that as, the issue that we try to treat, right? I think seeing that he didn't need the ACL surgery, like, I think that just really stuck home with me, because, it is possible. And sometimes, like, regardless of whether or not you need this procedure or not, I think it's really helpful to do some form of rehab.
Okay. So I look at that one of two ways. One way is the patient had so much inflammation, so much swelling, that you couldn't really tell if the ACL was ruptured. But the radiologist at the time just read the clinical history and was like, it's ruptured.
Mm-hmm.
Then a month later, you get another image. I would have taken that first image,
Mm-hmm.
given it to that ortho,
Mm-hmm.
and said, can you compare these two images
Mm-hmm.
and just tell me if it was ruptured in the first place? Because you can say, like, hey, listen, all the rehab we've done the last month, your ACL regrew and did its own thing. Like, it healed itself, right?
Uh-huh.
Or you can say that, like, well, it probably wasn't ruptured in the first place. Maybe this is a lesson of patience. Maybe you got the MRI too early. You should have waited a little bit longer.
Mm-hmm.
I don't know. Either way, the right thing happened, right?
Mm-hmm.
Because the patient went through your process,
Mm-hmm.
and your process led to the patient having less pain. And it turns out the patient's ACL was either no longer torn or just wasn't torn in the first place.
Yeah. There's no way that it regrew within the month, right?
None.
There's no way, right?
None.
I think it was just like, it just spoke to the fact that there was almost like a rush to get that procedure done.
Yeah.
Right. It's like, let's do it. Let's knock it out. Let's get this, and I think a lot of times, like, yes, it's hurt, but, like, let's see what we can do first. Right. And I don't think there's necessarily any harm in that. And I think it just differs based on the patient population, what they're trying to get back to doing. But yeah, that's just, yeah.
I mean, your relationship with your patients seems to be a little bit more intimate than physician and patient, right? I'm seeing a patient, making sure they don't die, moving on to the next patient, right? You're seeing a patient and you're evaluating their function throughout their life and how you can improve that function, right? Or you're seeing the patient and they may have gotten a joint replacement, and you're teaching them how to use their new implant with the function that they accomplish on a daily basis or whatever, or what have you.
Yeah.
So when you are evaluating those patients and you've made your decision on their gait and their function, what they're doing, what does that process look like for you in terms of therapy, in terms of physical therapy for you?
I think, like, for our practice, it's quite different from the traditional PT.
What are the 3 ways it's different? Give me just 3 ways.
3 ways. Our practice, we are holistic and one-on-one. So there's no assistants, there's no text, there's no aides. They're all 60-minute sessions. So imagine seeing any specialized healthcare provider for an hour, right? Some you might not need to, but I think with that time, you could probably learn a lot about the patient, right? And also, like, you're going to get real-time feedback, and constant lines of communication. There's always going to be, access to your therapist. So, yeah.
It's really interesting because as my daughter is going through physical therapy right now, and the physical therapy institution or business that she goes to is great. Like, they've been great, but she does get handed off quite a bit, right? So she comes in, physical therapist is there. They do their thing for like 15, 20 minutes.
Yeah.
Then one assistant takes her to this thing, and then another assistant takes her to the next thing, and another assistant takes her to the next thing. So it's really interesting that you say that, because at least what resonates with me right now is that is the first thing you said that was different. That is different. You're saying that when you come see Dr. Dang, you're going to come see Dr. Dang the entire time. You're not going to see Dang's assistant. You're going to see Dang, and I'm going to be working with you.
Yeah.
And I think that provides you with input,
which
is what you're saying is you take a lot of input from patients and what they're doing, and you think about that input, and then out comes your plan of care for that patient. And you're taking all the input in, not just 15 minutes here and 15 minutes there.
From the holistic standpoint, like what you're saying, I think it's really tough to get the progress you're seeking when you are being passed off from one to the next, right? Especially if they're like assistants, technicians, aides. But I think like everyone's like expectation with PT and what they want from PT is very different. With us, like, because we are a small practice, we're usually not the first stop, right? Most people, they've tried other types of treatment, chiropractic, they've seen acupuncturists, they've seen everyone, right? And they've eventually landed on us because it's like, oh, well, we'll just give them a shot, right? And so we understand that we're like kind of like the last hope for them before they try to do some other type of possibly invasive procedure. So with that, like, we have to take everything into account. They tried all these different things already and it wasn't helpful. So how can we approach it a little differently? And maybe there's something missing that was not caught by these other practitioners. So I think with the 60-minute treatment sessions, you get to learn a lot about the patient. And I think like that patient-provider relationship is very unique and very different from, other types of providers.
And when you're doing that, like if you evaluated somebody's gait, and we're going to stick with knee pain just because I think that's a common thing that people can relate to. And obviously I'm selfish.
Yeah.
So what do you do to alleviate these symptoms?
The quickest way to help alleviate someone's pain is to educate them, right? Like, what is triggering the pain, right? If you don't understand what's triggering it and you leave and all of a sudden the pain comes back, you're going to say, Tony didn't know what he was talking about, right? So I want to make sure we're on the same page right off the bat. And that's my job. I need to figure out how to trigger your pain and then give you the proper adjustments to alleviate that right off the bat, right? And on top of that, how can you do this on your own at home? So I want to give you the tools to be able to do this for the long run. Just because you get rid of the pain today, it might come back in the future. But I want to give you the proper tools to be able to address that. So education, it's a whole lot of education. It's a lot of talking, a lot of sitting in just, silence and just like seeing what's going on. And that works for most people. Some people, they just want to get straight to the work, right? But I think education is a huge part of it.
Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. Dr. Rutland, should I stop my pain medicines before physical therapy so I can feel what's really going on? This is a great question. Here's what I would say to that. There are some medications that can cause you to be less alert. If your pain medicine does do that to you, you shouldn't take it before physical therapy. However, other medicines like NSAIDs are going to reduce the amount of inflammation you have, also reducing some of your pain. Other medicines like Tylenol can do similar things by reducing your pain. Those medicines are perfectly fine before physical therapy because they do not affect your level of alertness. That's the buzz this week. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. There are some misconceptions with physical therapy, right? And what I'm going to do now is I'm just going to shout out some myths, some statements,
Okay.
and I want you to comment.
Okay.
Physical therapy is only for people after surgery or a major injury.
Why not avoid surgery or major injuries in the first place? Why not that?
Agreed, right? My kid does physical therapy, no major injury, no surgery.
Yeah.
She needs it, right, for maintenance. Physical therapy is just exercise that I can find on YouTube.
You can also go to YouTube to find out how to cut your hair or cook. But you don't do that because you probably will enjoy it much more. It's probably going to be much more efficient if you went to someone with the expert level of care.
I need a doctor's referral to start physical therapy.
In the state of California, you have direct access rights, meaning you can go and see a PT without a physician's referral, and you can start your plan of care immediately.
So you do not need a doctor's referral to see a physical therapist in the state of California?
No.
But in other states you do?
Some states. Every state has different regulations, and honestly, I can't keep up with all of them because it's always changing.
Yeah.
But California, no. That's your decision to make.
What do you think patients should know about physical therapy?
Physical therapy, I think it's for everyone. Not just if you're dealing with like pain or loss in performance, but even like, your daughter seeking to, be preventative, right? There's a lot of value in that. Things that you should always strive for to avoid PT is like just stay on top of it for the long game, right? So you don't want to just reach out for help when it's already become an issue, right? If you start to notice anything wrong, let's just nip it in the bud, right? You can just get in, assessed, and you don't need insurance, so you can just find a physical therapist and go over whatever issue it is you're dealing with.
So it sounds like to me what you're saying is everyone or almost everyone, and athletes especially should be evaluated by a physical therapist to assess their gait, their mobility, their strength, all of these things to try to enhance not their performance, but just their exercise function, make it more efficient, more balanced, all of those things.
Yeah, and I think like that's where, like for instance, when you were growing up and you're playing basketball, what was the routine or regimen for your training? Did you have one?
No, I just played in the park.
You just play in the park, but like when you go to the weight room, like in high school, was there a program that you followed?
We didn't have a program in high school. I mean, I'm 44. Like this is 1999, 1998, 1997, 1996. Like we didn't do what those guys were doing in 2000 and later.
But
right?
even till this day, it's like, yeah, let's get in the weight room, let's just lift, right? But it's like, there's ways to structure how you lift and what you lift and why you're doing certain things. And I think that goes over a lot of people's head, right? They don't really think about those things, right? Are you training specifically to your sport, right? Or things that you might need to complement your sport? How do you recover? That's never talked about too, right? So all these things, like, I think it brings so much value, especially if you're playing sports like 365 days a year.
Now, you've got a specialty that you really focus on.
Mm-hmm.
What is that specialty?
My specialty is more so just performance based, right? It's not a particular body part per se, but it's how can we get you to do whatever activity you're trying to get back into doing at the highest level without any limitations, and just making sure you don't get hurt doing that, right? So my specialty is teaching you how to do that, and hopefully you have those tools for the long game, right? I don't want it to be a case where you work with me and then 2 months later you experience an injury. I feel like I've failed at my job, right? I want to make sure you have all the assets and all the knowledge to be able to take this and keep going with it, which most of our people are able to do, which is why they continue to work with us. Yeah.
People have different lifestyles. And the way that I organize these lifestyles is I put them in different categories, right? There's people who are more sedentary, right? They're just sitting on the couch all day. There's people who go to the gym, and there's also people who go to the gym and they're on the elliptical versus running on the treadmill, right?
Mm-hmm.
Those are two different types of people, really. And then you also have the high-level athletes, right? So when you see them in your clinic,
Mm-hmm.
are you treating them a little bit differently? How do you approach them differently?
1000%. It's the person that sits at the desk all day, you have to be really realistic, right? And like really point out to them like, hey, I don't care how fancy of a chair you have or how nice of a monitor you have or how nice of a standing desk you have. If you're sitting all day, you're going to have X, Y, Z issues. Here are the, the most generic forms of exercise that you can do to keep mobile and feel pain-free. But just know that this is going to keep recurring because of this lifestyle. So if you don't correct this lifestyle, then these issues will consistently just return. Whether that's like, hey, you got to take phone calls standing up or go for walks every now and then, right? Get yourself a walking pad at home, right? These are common things that I recommend to my patients all the time. The gym goers that love to lift really heavy and come back with the same injury over and over again, I have a bunch of those. We break down the exercise in the session, do the same exercise together in person. And if they're able to do that pain-free, I give them, okay, this is what we focused on today. This is what you should do before you do this lift at the gym, right? So you can replicate, and it's very actionable. It's nothing fancy. It's very simple. This is what you should be focusing on. And most of the time that works, right? But some of them, it doesn't because whatever, right?
Yeah.
And then the high-level athlete,
Those are ones that can overwork, right? And
those are the trickiest ones, right? And they don't even need to be professional. They could, like, for instance, right now, the hot thing is marathon running, right? People love to push themselves. People love to get into that. And it's like no pain, no gain. But to get there, there's so much training that you need to do to get to that point. And sometimes they get right into it and they experience an injury as they just continuously ramp up their mileage, right? Or the volume of training. So for them, it's all about teaching them how to load manage, right? Give them proper protocols. Like, hey, these days you focus on these exercises, you rest for these days, right? So giving them very specific protocols that they can follow. Sometimes they do, sometimes they don't, but I can't really control that. I just do my best. Yeah.
Yeah. So you're managing these people differently.
Yeah.
Right. And the way that you prevent injury is probably different as well. Right.
Yeah.
For those people. Is there anybody off the top of your head that you treated besides your boy that did well? Somebody came in, they're like, listen, like, I've had this pain for years. I don't know if you can help me, but it's really bothering me now. Like, what can you do?
There's a handful of patients, but I think one that really sticks with me, older gentleman, we'll call him Mr. G, but he was like in his late 50s and he was close to retiring. He worked a long life, amassed a bunch of funds so that he can enjoy his retirement with his wife. But he had gone in for a knee replacement. And they found out that maybe a month into his rehab that he was allergic to the metal that they had put into his knee. So they had to go back in, remove it.
Spacer.
Put another one. Started rehabbing that. A few months later, they found out that that same knee, there's a fracture now, stress fracture. They had to redo that one as well. So fast forward 2 years later, that's when he met me. And he's pretty much given up, right? He's like, I'm never going to be able to use his leg again. I don't know, like they want me to do another procedure. But I think like he was really diligent about everything, all his exercises. Like if I told him to get any type of like equipment, he'll buy it right off the bat. And within the year, we were able to get him to start walking again without any assistance. And I think that really like resonated with me because naturally for me, I think I have a soft spot for older adults, and seeing him be able to do that again, when his bar was set so low, he has no expectations. He was ready to call it quits, right? And I think just seeing him be a success story, that was really inspiring.
It's a fantastic story. I wasn't really comfortable when you looked at me when you said older adults and having a soft spot. Yeah. That wasn't cool. But I do appreciate that story. All right, so we all have our things, right? And I'm going to ask you a series of questions, and we're just going to call this the honesty hour. I just want you to answer these questions honestly, all right?
Got it.
So here we go. First question for you is, what's your favorite movement or lift of all time?
For myself, a Bulgarian split squat. It targets all the necessary muscles. You can load it up pretty well, and it's pretty easy to do, and you don't need much equipment for that.
That would kill my knee. One injury prevention tip you wish everyone knew, but nobody would listen to.
Load manage.
Explain.
Most people, especially in our age, they find love for fitness again and they get back into it and they do it 5-6 days a week. And it's like, yo, you got to ramp it up. There's a ramp up period to this, right? So on top of that, you need to take rests, right, in between to allow muscles to properly recover, so that you can train to that same level again. Most people don't do that, and then they end up seeing someone like myself.
What's the most overrated wellness trend or product?
Ooh, this is controversial, but I would say
No, it's not.
orthotics.
Wow. Why? First of all, tell me what orthotics is.
Orthotics are customized insoles, usually prescribed by podiatrists, but nowadays people could just go on Amazon and find one.
So you just mean foot orthotics?
Yes.
Okay. All right.
Sorry, for orthotics. And people slip that into the shoes, and they think that will correct their back pain, their hip pain, and they're able to just resume with their everyday life. It's like, what if you took that off? Like, what if you wore a different pair of shoes? How are you going to respond?
Wow. What's your biggest pet peeve in the fitness or the rehab world?
Um,
Something that really pisses you off.
I think when people don't understand what's within their scope of practice. I think when you just do stuff that you have no business doing, right? Like, I think that's it. Like, leave that to the professionals.
Give me
Like,
an example,
um,
a specific example. There's something on your mind right now and
Oh.
you're afraid to say it. I want you to say it.
I think like you see a lot of times, and I think the lines are so blurred now, but sometimes you see like professional or personal trainers trying to rehab someone, right? I think there's a lot of value in seeing a personal trainer, athletic trainer, because there's a lot of things where you could bridge that gap. But that initial part where you're trying to just nurse that injury, that's such a valuable part that you don't want to just glance over. You can't just get straight to lifting these heavy weights before you learn how to move that limb again, right? So you still see it. It's present in like every sport, and that's why people don't necessarily rehab correctly all the time.
What movement or exercise do most people just completely butcher and get wrong? They can't move right. They just don't do it right. Their form is awful.
It's wild because like I think like almost every exercise I prescribe to someone, it could be performed differently by 5 different people. Um, and they all have a different reasoning for that, right? But the thing that I probably see that causes the most pain is probably like a squat, right? Them getting down to the ground, or even how they would carry something and how they would lift that from the ground,
Yeah.
right? I think that's probably one of the most common things, and very relatable, very functional. That's probably what I see the most.
All right. And here's the final question I have for you. And it's really more of a statement that I want you to finish.
Yeah.
All right. So I want you to finish this sentence. Dang, physical therapy is.
Dang, physical therapy is transformative. And I mean that not just from a physical perspective, but from a mental, right? Physically, you're probably going to get better. You're going to get well, but mentally, it changes everything, right? For instance, take like your knee. You came in with the knee injury that you've been dealing with for over 20 years. And that's kind of been the thing that's been limiting you, right? But what if we found out that it's not really the knee, right? And we treat everything else, and now the knee just feels better. And now all of a sudden, you're able to pursue all these other things. You're able to play sports with your daughters. You're able to get back to basketball. You don't have this lingering knee issue in the back of your head that's holding you back. And now you can probably get back to some competitive level, back to training. And that probably, I would say, is transformative. I don't want to just transform your body. I want to transform your life, the way you see it, the way you just go about it. I think that is where the value is.
Look, I think that that's a excellent closing point. Like I think for me, hearing you, like honestly, throughout this entire episode, I'm thinking to myself, how am I going to find myself in downtown LA so I can come see him to see? No, I'm dead serious, because like the way that you have sold, not your business, but the way that you've sold physical therapy in general
Mm-hmm.
is fantastic, because I've been dealing with this for 30 years. Like, what do I care?
Yeah.
Right? It's been 30 years. I can deal with it. But the fact that you're going to take the time, you personally are going to take the time to look at me for 60 minutes the first time I see you and subsequent times I see you to truly understand why I feel the way I feel is important to me. Where can we find you, Tony?
On Instagram, Dr. Dang PT. And we're located in Arts District.
And then your movement has its own Instagram too, doesn't it? What is that?
Movement Society.
Okay. And website?
MovementSociety.com.
And your physical therapy website?
DangPT.com.
Perfect. Thanks for watching, you guys. Really appreciate you guys listening on physical therapy. It's been a pleasure to have Tony Dang on today. He's been absolutely fantastic. We're on Instagram at The Health Exchange Podcast. We're also on TikTok at The Health Exchange Podcast. You can find us on YouTube, Apple Podcasts, Spotify, iHeart. Get us wherever you get your podcasts every Thursday at 6 a.m. Pacific, 9 a.m. Eastern. We'll see you next time.